Urogenital triangle. Boundaries. Anteriorly, lower margin of the symphysis pubis and the arcuate pubic ligament. Posteriorly, imaginary horizontal line joining the two ischial tuberosities. On the either sides, lower margin of the ischiopubic ramus. The urogenital triangle is covered by the following layers: skin, fatty layer of the superficial fascia, membranous layer of the superficial fascia or the fascia of Colles, contents of the superficial perineal pouch, perineal membrane, contents of the deep perineal pouch, superior fascia of the urogenital diaphragm. Description of different layers. Skin. In males, the skin in males presents a midline raphe that is continuous with the median scrotal raphe. The raphe indicates that this part is developed from the fusion of two symmetrical halves. In females, the skin presents a median cleft. The vestibule between the two labia minora, the urethra and vagina, open in the vestibule. Fatty layer of superficial fascia. It is continuous with the subcutaneous tissue of the adjacent areas. Fascia of Colles. It is a strong sheet of fascia which stretches across pubic arch and forms the lower boundary of the superficial perineal pouch. The upper surface of the fascia blends with the fibrous raphe of the bulbospongiosus pouch in the middle, and the septum incompletely divides the pouch into two compartments. Attachments. On each side, attached to the lower margin of the ischiopubic ramus. Posteriorly, continuous with the posterior margin of the perineal membrane around the transverse perinei superficialis muscle. Anteriorly, it is continuous with the dartos muscle of the scrotum. Fascia of penis, and then with the fascia of scarpa of anterior abdominal wall. Structures piercing the fascia. Perineal branch of posterior femoral cutaneous nerve. In females, urethra and vagina. Superficial perineal pouch. Superficial perineal pouch. It is an interfacial space stretching across the pubic arch and is situated below the perineal membrane. It is closed on all sides except in front. Boundaries. Superiorly, perineal membrane. Inferiorly, fascia of Colles. On each sides, inner surface of the ischiopubic ramus. Posteriorly, pouch is closed by the fusion of the perineal membrane with the fascia of Colles around transverse perinei superficialis. Anteriorly, the pouch is open and in continuous with the superficial inguinal space after passing deep to the dartos muscle and fascia of penis. Contents. Muscles, 3 on each side. Ischiocavernosus, covering the crus penis in males and crus clitoris in females. Transverse perinei superficialis in the posterior part of the pouch. Symmetrical half of the bulbospongiosus, covering bulb of penis in males, or bulb of vestibule in females. All of these muscles are supplied by the muscular branch of the perineal nerve. Ischiocavernosus. Each muscle arises from the inner surface of the junction of the ischiopubic ramus and is inserted into the sides and below the crus penis in males and clitoris in females. It compresses the cavernosus spaces of the crura, impedes the venous return, and thereby maintains erection of penis or clitoris. Transversus perinei superficialis. Each muscle arises from the ramus of the ischium and is inserted into the perineal body. It fixes the perineal body. Bulbospongiosus. In males, it is bipennate muscle. Covers the bulb of penis and the two symmetrical halves are united by a median fibrous raphe. In females, it splits into two halves to embrace the vaginal orifice and covers the bulb of the vestibule. In males, origin. It arises from the perineal body and the median raphe. Insertion. Anterior fibers cover the dorsal surface of the corpora cavernosa and form an aponeurosis superficial to the deep dorsal vein of penis. Middle fibers cover the dorsal surface of the bulb and corpus spongiosum penis and form an aponeurosis where they intermingle with the similar fibers of the opposite side. Posterior fibers blend with the perineal membrane. In females, origin. It arises from the perineal body. Insertion. The fibers end in an aponeurosis on the dorsal surface of the corpora cavernosa, superficial to the deep dorsal vein of clitoris. Actions. In both sexes, the muscle compresses the deep dorsal vein and helps in erection of penis or clitoris. In males, it expels drops of urine from the urethra and contracts repeatedly in ejaculation. Vessels. In males, two branches of perineal artery, namely posterior scrotal and transverse perineal. Four branches from the artery of penis, namely artery to the bulb of penis, urethral artery, deep and dorsal arteries of penis. In females, two branches of perineal artery, namely posterior labial and transverse perineal. Four branches from the artery of clitoris, namely artery to bulb of vestibule, urethral artery, deep and dorsal arteries of clitoris. Nerves. In males, three sets of branches from perineal nerve, namely posterior scrotal nerve, branch to bulb and muscular branches. Long perineal nerve from posterior cutaneous nerve of thigh. In females, three sets of branches from perineal nerve, namely posterior labial nerve, branch to bulb of vestibule and muscular branches. Long perineal nerve from posterior cutaneous nerve of thigh. Other structures. Crus penis or clitoridis attached to each side to the ischiopubic ramus. In males, bulb of the penis in the middle, which is traversed by the spongy urethra. In females, urethra and vagina in the middle. Bulb of the vestibule and the greater vestibular gland are present on each side of the vagina. Perineal membrane or inferior fascia of urogenital diaphragm. It is a strong sheet of fascia that extends across the pubic arch and intervenes between superficial and deep perineal pouches. It is triangular in shape with apex directed in front. Attachments. On each side, inner surface of istiopubic ramus above the attachment of crus penis. In front, it is thickened to form transverse perineal ligament and is continuous with the superior fascia of urogenital diaphragm around sphincter, urethral muscle. Behind, it is fixed to the perineal body in the midline and splits into two layers. Upper layer is continuous with the superior fascia of urogenital diaphragm around transversus perineae profundus. Lower layer is continuous with the fascia of colus around the transversus perineae superficialis. Structures piercing the perineal membrane. In females, at the base, two posterior labial vessels and nerves on each side. At the middle of the attachment margin, deep artery of clitoris. At the attached margin near the apex, dorsal artery of clitoris. In males, at the base, two posterior scrotal vessels and nerves on each side. At the middle of the attachment margin, deep artery of penis. At the attached margin near the apex, dorsal artery of penis. In the middle line, urethra about 2 to 3 centimeters behind the lower border of symphysis pubis. In males, duct of the bulbourethral glands and artery to the bulb of penis on each side of the urethra. In females, vagina behind urethra. Deep perineal pouch. It is an interfacial space across the pubic arch and above the perineal membrane. It is closed on all sides and presents the following boundaries. Above, superior fascia of urogenital diaphragm. Below, perineal membrane, that is inferior fascia of urogenital diaphragm. In front, transverse perineal ligament. Behind, fusion of perineal membrane with superior fascia of urogenital diaphragm. On each side, inner surface of istiopubic ramus. Contents. Muscles. In males, sphincter urethrae, which encircles membranous urethra. Transversus perineae profundus, which occupies the posterior part of the pouch. Both muscles are supplied by the muscular branches of the perineal nerve. In females, external sphincter urethrae. Sphincter uretrovaginalis. Compressor urethrae. Vessels. In males, artery of penis. Stems of origin of 4 branches, namely, artery to the bulb of penis, urethral artery, deep and dorsal arteries of penis. In females, artery of clitoris. Stems of origin of 4 branches, namely, artery to bulb of vestibule, urethral artery, deep and dorsal arteries of clitoris. Nerves. In males, dorsal nerve of penis, Muscular branches from perineal nerve. In females, dorsal nerve of clitoris. Muscular branches from perineal nerve. Other structures. Membranous urethra. In male bulbourethral gland and its duct on each side of the urethra. In female vagina, behind urethra. Superior fascia of urogenital diaphragm. Superior fascia of urogenital diaphragm. It is a thin fascia covering the upper surface of the muscles of the urogenital diaphragm and is derived from the pelvic fascia. Attachments. On each side, inner surface of ischiopubic ramus and thence continuous with the obturator fascia. In front and behind, blends with the perineal membrane and closes the deep perineal pouch. In the middle line, it is reflected by the side of the urethra and is continuous with the inferior fascia of the pelvic diaphragm. Urogenital diaphragm. It is a musculofacial partition across the pubic arch and separates the pelvic cavity from the anterior part of the pelvic outlet. It consists of two muscles, sphincter urethrae and transversus perineae profundus. In males and in females, external sphincter urethrae, sphincter uretrovaginalis, compressor urethrae, and two fasciae superior fasciae of urogenital diaphragm and inferior fasciae of urogenital diaphragm enclosing the muscles. Actions of the urogenital diaphragm. It supports the prostate or the bladder. In female, it constricts the vagina. It fixes the perineal body. Sphincter urethrae exerts voluntary control of micturition and expels the last drop.